there are complications. And the four most important complications are peripheral nerve injury, that can be permanent or just transient, block failure, just means the block doesn't work. You can have bleeding, hematoma, or you can have local anesthetic systemic toxicity. And we're going to talk about the two most important, or the things that I consider most important, because we don't have a lot of time, but it's the peripheral nerve block and the local anesthetic systemic toxicity. So the peripheral nerve block happens basically because here is your nerve and there's all the bundles and it's covered in a fascial plane. And what happens, or what they think it happens, because we are not entirely sure, is that it's more common when you put your knee through the nerve and you inject your anesthetic, and that may cause a permanent damage or transient damage. What you actually want to do with nerve blocks is that you don't want to put your needle or your anesthetic directly into the nerve. You want to do it in the fascial plane where the nerve runs, and then you put your anesthetic and you put it around it. You shouldn't round it. That's what you want to do. So peripheral nerve injury are rare. There's not much data and it's not reliable. Some people say that it occurs less than 0.1% of procedures. Others say it's 1.5 for every 10,000 procedures. It's rare, but it happens. And something that can tell you a worrisome sign is like if during the procedure the patient has pain or paresthesia, it may have been that you went a little bit too far and touched that nerve, or you put too much pressure and volume and it's actually just squeezing the nerve, which is also important to know about the volume that you're applying. And the local anesthetic systemic toxicity, or LAST, can happen because you inject anesthetic into a vessel, or there was a vascular uptake from having just a big volume or high doses with high concentration around the vascular, and it just goes through it. It happens more with lipophilic anesthetic. With bupivacaine, it's more lipophilic, so it's more common to have LAST with bupivacaine, although it's still not so common. They say it's 25 per every 10,000 nerve blocks. So it's not that common. But when you have a LAST, you're not going to be happy in your patient either, because it starts normally with signs and symptoms with the central nervous system. You have the patient starts to feel tinnitus, has a metallic taste, has perioral numbness, it may feel agitated, a little bit of confusion, drowsiness, it may have auditory changes, just like tinnitus, and it may end up to seizures. And then it can go into a cardiac toxicity later, which will give you hypotension, bradycardia, tachycardia, arrhythmias, and cardiac arrest. Sometimes it can go directly into cardiac toxicity and not go through the central nervous system or have both things at the same time. So normally what you do is you have to stop the medication, you have to give life support, and you have to apply a lipid emission therapy and ask for help. That's what you have to do. But it's important for you to know these things. And there are a lot of resources out there. And if you're going to start doing nerve blocks, you have to get yourself into know about these complications.